welcome to Sound Health on Lagos Television. I am Olasun Bomudupe. Today on the program, we are taking a look at cervical cancer, the fourth most prominent cancer in women. The World Health Organization says the risk can be minimized if women take advantage of HPV vaccinations, early screening, and treatment. Stay tuned. The conversation begins after this break.
Each of these achievements and many more demonstrated the power of science, solutions, and solidarity to protect and promote health. But 2023 has also been a year of immense and avoidable suffering and threats to health. The barbaric attacks by Hamas on Israel on the 7th October left around 1,300 people dead and over 200 taken hostage. Reports of gender-based violence and mistreatment of hostages are deplorable. This was followed by the unleashing of a devastating attack on Gaza, which has killed more than 20,000 people, mainly women and children, and injured over 53,000. At the same time, hospitals and health workers have been repeatedly attacked, while relief efforts are not coming close to meeting the needs of people in Gaza. As of 22nd December, only 9 of 36 health facilities in Gaza were partially functional, with only 4 offering the most basic of services in the north. For this reason, we continue to call for an immediate ceasefire. War and armed hostilities sadly have plagued too many other locations around the world, including Sudan, Ukraine, Ethiopia, and Myanmar, to name but a few. I saw firsthand the suffering of war-weary people in northwest Syria, Idlib, who, like communities I also visited in neighboring Turkey, were devastated by the terrible earthquake in February. Without peace, there is no health, and without health, there cannot be peace.
Thanks for staying with us. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Temitope Andero, consultant clinical and radiation oncologist at NSIA-LUTH Cancer Center. And he is going to tell us how to beat the increasing rate of cervical cancer in women. Good evening, Dr. Andero, and thanks for joining us.
Good evening, and thanks for having me around. It's my pleasure being here.
All right, thanks for agreeing to enlighten the public on cervical cancer. So before we look at how to prevent cervical cancer, tell us, what exactly is this disease?
Cervical cancer, it's the disease entity that is found at the cervix with certain uniqueness in that it is not just like any other disease at the cervix. It is a cancerous disease. In other words, we are talking about certain changes that happen at the cervix. The cervix in itself is the lower part of the uterus. I mean, commonly known as the womb. Right. And then we're talking about some transformations that take place over time, resulting into a kind of a growth that doesn't stop. And then over time, it begins to show some, clinical manifestations, the symptoms and the likes. It doesn't stop there. It, of course, over time, to spread, that we know in oncological space as metastasis. And in this case, it begins to affect some organs away from the primary location, and that is when it now becomes life-threatening. We're talking about such organs as the lungs, the bone, and even the liver. And at that point, it becomes life-threatening. And that is why cervical cancer becomes, a global burden. And if I must add, in Africa generally, out of 100 women, about 34, 100,000 women, about 34,000 cases are diagnosed annually, out of which about 24,000 of deaths are recorded. And back in Nigeria, in 2020 alone, up to 12,000 cases were recorded, diagnosed of cervical cancer, and about 8,000 of them, died of the same disease.
Okay.
And that is why we cannot but, put in more effort to create this awareness as it's being done right here,
Okay.
right now. Thank you.
All right, Dr. Andero, looking at the statistics you raised, you highlighted now, why do women still wait till this stage before we seek medical help? Maybe you should start by telling us the certain changes one should look out for. Those changes you mentioned earlier.
Okay. This is pretty much like putting 2 points together, but of course I will do justice to both of them. Before we talk about the changes that they have to watch out for, even the women in themselves, they need to be aware of the fact that there's something called cervical cancer. Unfortunately, we live in a part of the world where, awareness programs, screening programs are very, abysmal, right? So, and then our women, most of them that walk through, my consultation in my practice, some of them, majority of them never heard about screening before they were diagnosed with cervical cancer, you know, and then, as opposed to the way it obtains in, a lot more developed countries and in the West, where there are efforts in place on a regular basis to push information across to the community regarding creating this awareness about what's called cervical cancer, things to watch out for, like Rebecca asked me, things to do to prevent it. Okay, now, talking about things to watch out for, so that will take us to the symptoms of cervical cancer. At the initial stage, it is actually asymptomatic. There are so many women who are out there going all around with some kind of pre-invasive, pre-cancerous conditions because it has not really manifested. So everybody feels, okay, everything is okay. But in the actual sense, everything is not okay. At the point where it begins to show, some symptoms, right, such as bleeding. This bleeding could follow, post-coital bleeding, that is bleeding after sex for those who are still sexually active. Such bleeding as in between their menses, intermenstrual bleeding, or even excessive bleeding. And for those who are already post-menopausal, all of a sudden they can just discover that, okay, wow, I'm still bleeding. I'm talking about people in their late 50s and 60s. And, because of our social-cultural environment, it is not unlikely for our women to say, okay, it is because of A or B or C, and they will keep it to themselves until it becomes a lot more advanced. And then that will now take us to when we are now dealing with a lot more advanced disease. At this point, of course, it has encroached to the surrounding tissues and organs, like the bladder. You now see some women peeing blood. They are having pains at, when they want to pee. And of course, by the time it has also encroached to the back, posteriorly to the rectum, they want to poop and then they notice some blood in their poop. And by the time it now begins to encroach into the more surrounding tissues, they're now having, pains, waist pains, and the likes, bone pains. And by the time it is a lot more advanced, like maybe terminal stage, of course it's already in the lungs and they are coughing, and a lot more. So, at the instance of noticing anything abnormal, as little as, okay, excessive bleeding, I mean, abnormal from, different from the normal menses, in whichever way, it could be a red flag, and such an individual should seek for urgent medical attention. And it is also good to note that, this disease entity is more common, I mean, middle age. Of course, the peak age, you're talking about 50s, even though, of course, it is in the range of from 30s and above. And that is why emphasis is placed so much on screening. I guess we're still going to talk about that, like pap smear. Yes. So, in summary, things to watch out for. Um, you know, the earliest signs, symptoms, could just be abnormal bleeding, even though for a long period of time it might not even show anything. Right.
Okay, let us move on to screening now, because they say prevention is better than cure. Prevention is the key to treatment and all that. So let us move to screening now. What are the different alternatives we have? Is it just by noticing? Are there other medical steps or procedures to look out for or to go for?
Yes, yes. Like you did say, prevention is the key, right? And of course, early detection too, for those who are lucky to have been diagnosed very early. I mean, it can impact the overall survival of their disease. Now, talking about the screening, I would talk about both screening and prevention. I did mention earlier that in the West, this disease, entity called cervical cancer, has been driven to the background. You have lesser and lesser cases each year, and it is primarily due to effort put in place by the government, or a collaborative effort by the government and corporate organizations and institutions. And those have to do with vaccination, emphasis on vaccination. Now, we do know that young girls and even boys, I mean, that is not, boys don't have service, but the implicated organism, the human papillomavirus, has also been implicated in, other
Boys.
diseases found among men. But that's not why we're here. Now, back to cervical cancer. So, from age 9, as early as 9 to 12, you know, um, young girls are supposed to be vaccinated against human papillomavirus. And why this age is critical is because that is the time before they have any sexual exposure. And the way the vaccine works is that it kind of primes the body in such a way that by the time the individual is exposed to these viruses, it's, the body immune system has been prepared to tackle and fight against it. So it does not have a place in the system anymore. And by the way, talking about vaccination, we have different strains and subtypes of these viruses. So we don't have even a single vaccine that covers, all types. And by extension to talking about vaccination, even pap smear is still recommended alongside. Now, even in the US, the vaccination age has even been increased to, initially it was increased to 25, but now to 55 years. I mean, to 45 years rather. Right. So, and that is to take care of, you know, other age groups that might not have been exposed to different subtypes of human papillomavirus, the culprits. Right. So, still talking about prevention. So, vaccination is key. And in recent time, I must give credit to the government and the corporate entity for the collaboration. I mean, I listen to my radio in my car and I see a lot of efforts to create that awareness, to disabuse the mind of the community about the benefits of vaccination for our young girls, you know. And I mean, my girl came back from boarding school and I asked her, did you hear about it? She said, yeah, Daddy, I was vaccinated. I was excited. Our cultural background, we have this belief against vaccination, looking at it as something that might have some adverse effects. But in the reasons of it is very beneficial. in the long run. So screening, yeah. So talking about screening, this is also key. Not everybody will be privileged to have the benefit of being vaccinated, either because of age or because of, I mean, it's just not accessible or it's not,
Location.
anyway, thank God now they're trying to make it free. But not everybody, before they reach a particular age. So screening is key. And it is, at least in a developing country like ours, where vaccination, is still like in its lowest, at its lowest level. So we encourage that women from age 21, sexually active or not, should make themselves available for pap smear. What is pap smear? Pap smear is just a procedure where a physician or a trained medical, personnel take a swab of the cervix, right? And they just sweep around the cervix, put it in a solution, send it to the lab. Why? To look for some abnormal cells. The outcome could be, abnormal cells or normal cells. For normal cells, it means that, okay, now you are good to go. However, repeat the screening in 3 years, every three years. Now, if the result comes out to be abnormal, it now, it might not be, pronounced as being overtly cancerous at that point, but it is an indication to now go for that first floor for colposcopy. And when the gynecologist now examines and he feels that, okay, I think there is a need for us to take a biopsy because of some abnormalities found, then they go ahead to take a biopsy. And in either way, it can help to diagnose the disease in its earliest, at its earliest level, and then nip in the bud. And fortunate enough, cervical cancer is one of those diseases that can be cured if it's at its precancerous level, pre-invasive level. Yes, it can be cured like 100%. And of course, such an individual will still continue to subject herself for screening. So pap smear is key between the age 21 to 65, 3 yearly. And then at the age of 30, screening for human papillomavirus can also be included. And if found negative, right, yeah, then such a test cannot be repeated every 5 years. Right. So screening is so very, very important. You see, it is good to know that every individual living, about 80% of individuals living will be exposed to human papillomavirus at one point of their lifetime or the other. But naturally, most people, their system will clear it over time. But what we're saying is we now have a percentage of people whose system will not be able to clear it. And then the virus will persist and over time will cause some transformation around the cervix that will now proceed to causing an invasive cancerous condition. Right. So that's what we're talking about. So screening is key.
All right.
For prevention.
All right. Dr. Andero, thank you so much for that detailed explanation. So let's look at those people those women living with the condition or diagnosed of the condition already. Is it the end of the world? What can be done is there any remedy after the diagnosis?
Absolutely. Yeah, that's a very good question. Once again, in this part of the world where we connect a lot of cultural and spiritual things to every condition we have, it is not uncommon to see women attributing their ailments to being caused by, enemies, witches, wizards, and everything. And to that extent, it also impacts their outlook to all these conditions where they think, okay, this is going to happen or that's going to happen, if not among the educated and exposed. Because information is just at the palm of everybody's hand, now. They press their phone, they Google cervical cancer, and when they are not guided, so what they think is that, okay, maybe they are going to die next week, next month, or next year. But the good news is, yes, cervical cancer, even though it's cancerous, if detected very early, it is not life, I mean, it is not the end of life. Absolutely, it is not the end of life. However, early diagnosis and starting treatment is key, and that can help towards, having a very good outcome. And, the overall survival is very good. We do know that when patients come very early, about 91%, about 91% of them have overall survival of, after about 5 years. Yeah. But then when it's already late, we might have less than that, maybe less than 50%. So even though it is a lifetime management, we don't talk about a cure, but we talk about a lifetime management. But then to survive this cancer, has a lot to do with the time of presentation when the patient presents at the hospital. But then we still let the patient know that it is not a death sentence. You do the needful. Do not patronize quacks. Do not resort to taking herbal medications or all the natural products that fly everywhere that bubu niche. If you take this medication, it's going to cure your cancer, it's going to cure your hypertension and everything. And by the time they walk through your door for consultation, they're already at stage 4, terminal stage. And at that point, you have you really moving to do a lot for them. And that's the time you start hearing that they went to the hospital, the social person went to the hospital, and after being given this medication, the person died. And people also pass the same information around to some other people, giving an impression that people died of the treatment and not the cancer. But in the reasons of it, it is just because such individuals, they don't even present on time. And by the time they come, your treatment will not be able to do a lot for them, aside from just some palliative care. And by the time the inevitable happens, people might go to the treatment as opposed to advanced disease.
All right.
But back to answer your question, being diagnosed of cancer of anywhere, it is not a death sentence. However, early detection is very, very important regarding the survivor, the overall survivor, and the outcome of the treatment.
All right. Early detection is important to the overall survival of cancer, especially cervical cancer.
Yes.
Dr. Temitope Andero, consultant and clinical and radiation oncologist at NSIA-LUTH Cancer Center. Thank you so much for your time and expertise on the program.
My pleasure.
All right. Sound Health continues with... You're welcome, sir. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television, and we have been talking cervical cancer. We all have a key role to play in ending the trend of the disease in Nigeria and all over the world. It could be me, it could be you, your sister, or colleagues. Early detection is key. Learn, prevent, and screen against cervical cancer. For comments and inquiries, or you have topics you'd like us to treat, send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.